Good Tuesday afternoon. I'm Katherine Killen, Deputy Senior Director of Strategy for the Knox County Health Department. My colleague, Charity Menifee, is here with me today to help answer any questions at the end. I'll start this afternoon by talking about our moment of gratitude. Today, it's dedicated to the businesses and employees who are diligently working hard to protect our community and help keep everyone safe and healthy. Thank you for following the guidelines and doing what you can to protect public health. We also want to take a moment to spotlight the great work our community has done up to this point. We know there are some folks in our community not wearing a mask or physically distancing, but that doesn't discount the many, many people who are. If the majority of people do the right thing, that continues to set up our community for success and a path forward. A big part of public health and life in general is relying on people to do the right thing and on personal responsibility. And for the most part, people in our community are doing exactly that. The folks who are wearing masks and physically distancing and following all of the 5 core actions are not only looking out for themselves and their families and their loved ones, but all of us around them, and even those who aren't following the guidelines. We urge everyone to keep up these practices because, again, it will take all of us working together to keep our community healthy and moving forward. Now for our local situation. We have 352 confirmed cases of COVID-19 in Knox County. Additionally, we have 10 probable cases. 313 of our cases have recovered. 40 individuals have been hospitalized at some point in their illness. 2 Knox County residents are currently hospitalized. And we are thankful to report that we have no additional deaths due to complications from COVID-19. Regarding the local situation, we had a statistically significant increase in cases over the weekend and going into today. While this is not an outcome we want to see, as we've mentioned before, we do expect to see an increase in new cases as our community reopens. We will continue to keep a close eye on this, and as always, we'll continue to investigate new cases and evaluate these data points as we measure our weekly benchmarks. In regard to testing, our schedule is a bit different this week due to the holiday yesterday. We are testing today, tomorrow, and on Friday in a drive-through format. Thursday is reserved for targeted testing. We'll now open it up for questions.
All right, please go ahead and submit your questions into the chat feature. And as a reminder, please type in which media organization you're with and your name. The first question we have is from WVLT. They ask, is there any evidence that reopening and phase 1 activities are connected to the 10% increase in cases over the past 8 days?
For our local situation on that, we'll let Charity Menifee take that one.
Hello. I think that we are past that phase 1 of reopening. It's been enough time for us to see that we are seeing an increase in cases, likely due to people being out and about more. And it's not to be unexpected, but we are watching it very closely, and we'll continue to do that as we move forward.
From WBIR, state figures and Knox County figures show a clear discrepancy in the male versus female COVID-19 case count. More males clearly have gotten it. Do you have any thoughts on why this may be?
I don't. Yeah, that's actually a very interesting piece of data we've looked at as well. And we really don't have good evidence behind why that may be yet. I also know that that's being looked at. I think that trend is similar across the country as well. So more information to come. We'll be looking for that as well.
From Sentinel, what was the statistical significance of the increase in cases you saw over the weekend? Are you just talking about the p-value, or is this in reference to the statistical boundaries you outline on your benchmarking criteria?
It's in reference to the statistical boundaries. So we've had a single standard deviation shift over a 3-day window. And that would reflect on our benchmarks, but in full transparency, we wanted to mention it right now since we did see an increase.
From WBIR, some places are posting about being 12 feet apart, not 6. Is something changing, or is this just extra precaution?
All right, so the guidance regarding 12 feet is a shift regarding two factors: exercise and singing or plays and such where you are projecting, because it's thought that more virus is expelled further when those activities happen. So in those areas, we moved from 6 feet to 12, thus doubling the minimum recommended distance.
For the Knoxville Liberty Press, can you please, we're asking everyone to please put their names in with their questions and the media outlet as well. So if you could please identify yourself, that would be great. Thank you. From WBIR, Hamilton County has seen a sharp jump in virus cases since last Friday, more than 160 new cases. You have said health department leaders statewide communicate often. Are you aware of this? And is it playing into your thinking about Knox County and what could happen here?
Yeah, well, let's shift to Charity then.
Hi. So I had not looked at that. We do talk regularly. We have a call twice a week, and normally it's on Monday. So we didn't have our call yesterday with the holiday, but I'm sure that we will talk on Thursday about increases that are being seen and any recommendations that the state have related to that as we move forward.
Also from Katie with WBIR, can businesses be held legally liable if any employee gets sick at the business? And what about if a customer gets sick?
And so legal liability, we are not attorneys. And so we would think that would depend on a lot of different factors, but we would recommend that those conversations happen between the business owner and their legal counsel.
From Sean with the Knoxville Liberty Press, how is the Department of Health controlling air movement within establishments to reduce the transmission of droplets within the air?
So we can't control air movement in establishments, but it is one of the things that we've added into the plan following CDC guidance about opening windows and doorways when it's both practical and when it's allowed by that business's particular regulatory authority.
From Megan with WVLT, should individuals remain hesitant to participate in unnecessary activities as many recreational businesses return to operation?
Well, I think even in phase one, we talked about the importance of making decisions that are right for you, your health, and your family, and that continues. And so, again, look to your own health and whether or not you fall in that high risk, or whether or not you help someone who falls in high risk or live with someone in those categories, and make the best decisions that you can with the information that you have. Obviously, consulting with your healthcare provider, and you can also call our information line 215-5555 for other COVID-related information.
From Sean with the Liberty Press, while Knox County has fared better than other areas in the state with currently 34 active cases out of 471,000 people, what specific data has been used to determine why Knox County is under more stringent reopening and recovery policies than the state guidelines require?
Hi. So we have set our benchmarks, and they're available in the phase one plan, utilizing the recommendations and the data that was available when those were being drafted a month or two ago. And really that was looking at new cases and, our hospitalization rates and all of the things that our benchmarks recommend. We really wanted to look at how this is being spread. We've been successful so far, as you can see, with our numbers being lower, and we want to continue that moving forward. So we really wanted to be cautious and make recommendations, the best recommendations we could to help protect the community.
From Brian Hornback, is there a planned reopening task force meeting in the immediate future?
Sorry for the shifting back and forth, and thank you for your patience. There is not a scheduled meeting yet, but I believe, as Dr. Buchanan has stated previously, we will publicly announce that meeting when it is scheduled, following any appropriate rules and regulations regarding that.
From WBIR, they have a viewer question. They ask, what is your plan if and when COVID-19 cases spike in June?
If and when.
Okay. Just like we've been saying that we'll do, we're going to continue to investigate all the cases as they come in. We'll interview them. We will do contact tracing, making sure that the cases that are sick stay in isolation and that they're close contacts. Quarantine appropriately. We will continue to look at all the data and make recommendations moving forward based on what the data is showing us on how we progress through the summer. And that's with our leadership as well, city and county leadership as well.
From Sean with the Liberty Press, Knox County has had more stringent regulations and guidelines than the state standards require. Who made this decision? The Board of Health or the health director?
So I don't know that it's more stringent across the board. There are some cases where they are slightly different. Sometimes there might be a little more restrictive and then sometimes they might be a little more flexible. But that again was in the governor's order that local jurisdictions may do so, either be more stringent or less. And those decisions, as we've stated many, many times about our reopening plan, are made under the discretion of Dr. Buchanan as our public health officer, with guidance and feedback and research, including the CDC guidelines, state guidelines, other federal resources such as the Johns Hopkins Center for Health Policy, as well as feedback from our community through our surveys and, of course, the task force.
Their follow-up question from the Liberty Press is, has the County Board of Health voted or issued a policy in regard to the COVID-19 restrictions within our community?
No, they have not.
From the Sentinel, Vincent asks, can you explain the selection process for the people sitting on the reopening planning committee? There are representatives from the business and finance community, county and city government, but no other community groups seem to be. Can you explain how this committee was selected?
Sure. Well, it started actually as two independent groups. And so Dr. Buchanan convened myself to serve on that committee with Chris Caldwell, Krista, the finance director for the county, Krista Begg, our benefits director, and Stephanie Welch to begin our process of having some discussions about this. At the same time, Mayor Kincannon had asked some community volunteers, and Mike Odom, how could I fit Mike with the chamber, to help with their process as they were advising the governor as a part of all of the city mayors. And so then after the two were convened, we had an ask from the city to combine the two, and we did. And so it was really a merging of those two groups.
From Austin with WATE, with high school sports allowed to begin practice today, are there any new specific guidelines for coaches, players, parents, etc.?
I think when it comes to schools, especially and coaches, in addition to the guidance that we have in the plan, which references state and CDC guidance, a big part of that is also staying on top of that and looking for that new guidance as it comes down as well.
From Katie with WBIR, the Cove and other parks have been packed with people, clearly no social distancing. Should Knox County be doing anything to discourage this behavior? And what warning do you have for people not following guidelines?
Well, I think anyone not following guidelines, it's certainly disheartening. They're there for a reason, and that's to protect you and to protect our neighbors and our community. Regarding enforcement, per counsel with the Knox County Law Department, our enforcement is more not, instead of preemptive, it's responsive. And so in that, anything that we would do would have to be associated with known cases. And then our work on focusing on breaking that transmission instead of proactive enforcement. And also, and is always important, and we find this in our regulatory work that we do year round, education is a considerable part of that and an effective part of that. So we are continue to work on that. Being outside is great, getting exercise is great. But even when you're in those environments, we still need you to practice the 5 core actions.
From Sean with the Liberty Press, he asks, these were drafted by who and why? Sean, are you referring to the guidelines? If you wouldn't mind typing a couple more specificities in there, and we'll be happy to answer your question. From Scott with the Compass, is the increase of cases over the weekend enough to change the traffic light signal to yellow?
As you know, we release our benchmark data on Friday, but at this point, we've actually had 2 days of increase. So we look for 3 days, and so we will continue to look at that as we move forward. And yellow is kind of our warning. So it means that we need to look at it, pay close attention to it, and follow up when necessary. And we will continue to do that as we move through this week.
From Katie with WBIR, Knox County is reporting 10 new COVID-19 cases today. That's the highest day-to-day increase in a while. What do you attribute the increase to? Reopening? And should we expect more cases as the county reopens, or is this not significant?
No, I mean, there was a statistically significant increase in cases, as we mentioned in our remarks earlier, but it's not unexpected. We do expect to see more cases as people are getting out and about more and interacting more. But that's why we go back to those 5 core actions and really asking people to take it seriously and follow those recommendations of staying 6 feet apart, washing their hands frequently, wearing masks to protect others, disinfecting surfaces frequently, and staying home when you're sick. All of those things will help us to continue to keep that low. But as we've said from the beginning, we did expect more cases following reopening.
From Sean with the Liberty Press, as a follow-up on his question, he said, just to be clear, the Board of Health has made no policy in regards to the COVID-19 restrictions and shutdowns.
No, correct.
Then he says this was done unilaterally by Dr. Buchanan then.
So I think we've outlined that process and the groups and the parties that were involved in advising it. But yes, this document are guidelines developed by and distributed from the Knox County Health Department as a recommendation for preventing COVID-19. It's we're providing local guidance based on local data.
It says per county charter, quote, the director of the Department of Health shall act in concert with and meet all applicable policies established by the County Board of Health. So I guess this goes back to his question about who made the guidelines about benchmarks, which I believe you just answered. So if there were any further questions in there, please go ahead and type them in. From Brian Hornback, are the newer cases as severe as the first cases of COVID?
Yeah, that one's it always has kind of met a spectrum of severity of cases. So I can't tell you exactly where we are with the 10 right now. We don't have any additional folks hospitalized at this point. As we reported today, we're still at 2. But severity really is very subjective, and it moves across the board. And there's no difference now from previously.
From the Sentinel, Vincent asks, is the increase in cases over the weekend linked to a specific cluster or clusters? If so, where approximately were they identified?
No, we are investigating one very small cluster, but it is not at all the vast majority of cases with the increase over the weekend. The vast majority of the cases are not related that we can tell at this time.
From Austin with WATE, over the holiday weekend, several photos and videos of people in large groups went viral. Were there any complaints about local businesses or recreation areas not following social distancing guidelines?
I don't have the information in front of me about specific complaints from over the weekend, but I would say that we just continue. Again, it's worrisome for us. I mean, just being honest, for me, from the perspective, it's worrisome when you see pictures of people out and about not following the guidelines, to know what the consequences of that can be. So again, we ask people to please continue to follow the recommendations, the 5 core actions, to help protect the community as well as themselves, their family, their loved ones.
Any other questions? Please go ahead and submit them now. All right, since we don't see any questions coming in, we appreciate you all joining us, and we hope you have a great rest of your day. We'll see you tomorrow.